Welcome now, Dr. Omar Awan, Senior Public Health Contributor for Forbes. Dr. Awan, good morning, and thank you so much for joining us.
My pleasure. Thanks for having me, Nick.
Absolutely. Let's jump right into this because you and I both know getting prescription drug prices down has been a priority for so many Americans. And now the president says he's doing something about it. What stands out to you?
Well, I think it's a well-intended initiative, Nick, because healthcare and particularly drug pricing has become increasingly unaffordable for the average American. And when you think about uh, people, they struggle to buy drugs. I mean, 4 in 10 Americans experience medication insecurity, which means that they're not able to afford a prescription. Sometimes they have to, not take a medicine, or they have to split doses just to save money. And that's a problem. And this is why it's so critical and important that President Trump and his administration are tackling this head on. But with that said, I do believe that there will be a limited impact overall of this because, as you stated and as you showed with the data, the vast majority of Americans have private health insurance, which means that they're able to access a lot of these drugs on the TrumpRX at a cost that's much less than what's on the TrumpRX website. So, for example, if you take the obesity drug Wegovy that I think most people know about, the oral pill is about $150 on the TrumpRX website, but people who have private insurance can get that same drug for $25 with a copay. So you can see the marked difference in price. And that's the vast majority of Americans. But I do believe that people that are uninsured, which is about 8% of Americans, 27 million Americans, will be able to benefit significantly because they'll be able to get these medications at a discounted price when you compare it to the original list price.
And Dr. Wan, I think that when you talk about just an opportunity to have drugs cost less here in the United States, I think one of the reasons that may get people excited is because you and I can remember when former presidential candidate Bernie Sanders was organizing bus trips to Canada to buy drugs because it was so much cheaper there. And Tom pointed out that this benefits those who don't have health insurance, roughly 10 to 15% of Americans. Now, that's according to some estimates that talk about just the number of people who don't have health insurance. You have to pay out of pocket for the prescription drugs offered on TrumpRX. What kind of an impact, if any, will it have on people who do have health insurance?
Well, it's going to have a very, puzzling impact, quite frankly, for those that do have health insurance. The way that it can benefit them, though, I will say, is those who pay high deductibles. So for those that have to pay high deductibles, they can then go to the TrumpRX website and buy a medicine for much cheaper. And I think where this will really be impactful is for fertility drugs. We know, you and I both know probably, that fertility drugs are extremely expensive, even if you have health insurance. So if in that case, you can go to TrumpRX and buy these drugs as significantly cheaper. But remember also, this comes with limits because only 43 drugs are included on the TrumpRX website currently. Of course, that number is expected to increase with time, but for the vast majority of drugs that are on there, I do believe that those that have health insurance will not benefit significantly from those drugs that are on TrumpRX.
And Dr. Awan, I don't want to take anything away from drugs like Wegovy and the others in the weight loss drugs, but I have to believe you, working in this field, there are drugs you'd like to see on the list that are not on the list that you might consider a higher priority.
Absolutely. I mean, well, there are so many drugs, you talk about blood thinners, some of which are on the list, cardiovascular drugs, drugs that control blood pressure. These are all important drugs, particularly because heart disease is such an important problem in America. Now, Wegovy and obesity drugs are also very important when we consider that 3 in 4 Americans are either overweight or obese. And to make these more accessible is very important. And I think it will curb the obesity epidemic and many chronic medical conditions, which is the focus of the Trump administration, the Secretary Kennedy, and what he's trying to do. But with that said, again, most Americans do have health insurance, and they can get most of these drugs at a lower price than what's on TrumpRX. So that's an important point that I want viewers to understand.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.